Welcome to Northamptonshire Safeguarding Adults Board's overview of Safeguarding Adult Review 024 Adult A. We might refer to the Safeguarding Adult Review as a SAR or a review during the session, but they are the same thing. My name is Suzanne Bindley and I'm the Business Manager for the Safeguarding Adults Board. I'm joined on this session today by three colleagues. Firstly, Heather Roach, the independent author of the report.
Hello.
Georgette Fitzgerald, Chair of the SAR subgroup.
Hello.
And lastly but not least, Chloe Roberts, Project Officer with the Safeguarding Adults Board.
Hello.
So the aim of this session is to provide you with a brief overview of the Safeguarding Adult Review, the findings and the learning. I'm going to hand over to Georgette now, who will take you through the background to the case.
Under Section 44 of the Care Act 2014, Safeguarding Adults Boards have a statutory duty to carry out safeguarding adult reviews. There must be a review for an adult with needs for care and support when neglect or abuse is suspected, and there's reasonable cause for concern about how agencies have worked together. Northamptonshire Safeguarding Adults Board has a specific responsibility for determining whether a safeguarding adults review is required for adults that live in Northamptonshire. The key purpose of a SAR is about learning. It's not about blame. It's a supportive multi-agency process where agency contact and practice is looked at and lessons are identified. Reviews need openness and critical analysis, and they explore the decisions made and actions taken. Gaps in practice are identified and good practice is also recognised, and recommendations are made to change or improve practice and services. So SARs are about identifying and learning lessons, and these reviews look at what actions need to be taken and what changes need to be made, especially in the way we all work together to safeguard adults. It's not about apportioning blame to individuals or to organisations. The Northamptonshire Safeguarding Adults Board maintains oversight of any agency actions. Some general points about safeguarding adult reviews. They're led by people who are completely independent to the case. So Heather in this case is independent, she's the independent author. They're supported by agencies who've worked with the adults. So panel members will be there who haven't been directly involved in working with the adult. Families and key personal contacts are also involved in contributing to the review. And SARs are usually published, and for Northamptonshire, they will be on the Northamptonshire Safeguarding Adults Board website. So a little bit about the referral for this SAR. This review is about Adult A. Adult A was a 51-year-old woman who was admitted to Kettering General Hospital in September 2021. That was following an emergency call to her home. So ambulance services attended her address and found her to be severely malnourished, covered in dirt. She had insect bites on her body and head lice. Adult A was a grandmother who had lived with 3 generations of her family. The family were known to several agencies. The referral noted that Adult A had not left her home for 2 years and had not been downstairs in her home for some months. The review considered the 4 months immediately preceding Adult A's admission to hospital. And some of the key elements of the terms of reference were agencies clear about their roles and responsibilities, particularly in regard to identifying safeguarding concerns. It also looked at how effectively information was shared between agencies who were supporting various members of the families. It also looked at whether there were any barriers to practitioners in identifying how complex the situation was or to accessing the required interventional support. It also looked at how well Adult A engaged with agencies and whether there were opportunities for agencies to develop more effective strategies to work with individuals who didn't engage. Looked at best practice about Adult A's self-neglect. Was the self-neglect recognised? Was there consideration of any assessment of this lady's mental capacity and her decision-making abilities? And also, were other members of the family considered as young carers or having carer responsibilities? And how were they supported in these? I'm going to hand over now to Heather, who's going to take us through the key elements of the review.
So as Georgette's outlined already, Adult A hadn't left her home address for a significant period of time. There were concerns around her home environment. It was unhygienic and cluttered, and she got this long history of non-engagement with services. We discovered that she was vulnerable to cuckooing, and there was information around potential drug use within the address. Information around Adult A and her family dated back as far as 2013. She was described as a priority family. Drugs warrants were executed in 2015 by the police, and there was intelligence in 2017 and in 2021 in relation to potential drug use. In January 2021, there was a medical incident involving one of the family from within the home, and a safeguarding referral was made to the multi-agency safeguarding hub. The family had involvement from many professionals throughout the times that we were looking at under the terms of reference. There was involvement of an occupational therapist. There were the disabled children's team, a social worker, a strength and families worker. There were also applications made to Northamptonshire Housing Department by both Adult A and also her daughter. Safeguarding referrals were made in the May, June and July of 2021, and there were face-to-face visits made by various professionals in June, July and August of that year. And in July, there was also a child in need meeting. A referral for Adult A was made into adult social care on the 9th of August 2021. So there was a lot of activity in relation to professionals who were working with Adult A's family.
Thanks, Heather. That's really informative. As part of the review, you identified 6 key areas of learning. I wonder if you could tell us a little bit more about the roles and responsibilities and identifying safeguarding.
So in terms of roles and responsibilities, we looked at the professionals who were involved with Adult A and her family, and to a large degree, everyone carried out their roles and responsibilities effectively. They knew what their role was. However, what we found was that really professionals need to consider that safeguarding is in its widest sense. So in respect to both adults and children, recognising what whilst their individual role may be related to supporting one aspect of the family, they also really need to be alert to each family member and to recognise when there's potential evidence of abuse or apparent neglect and to take that action. So it's about thinking wider than their own role. The other thing we identified was that there are other avenues of support as well to assist families and individuals, and so those kind of referral routes into things like the Northamptonshire Fire Service, looking at the pathways into other professional routes for support, also needed to be clear, and frontline professionals need to know how to do that. There is a hoarding protocol. It's a multi-agency protocol that you as the board support, and really that is something that needs promoting across all of the agencies so that your frontline professionals have a real clear understanding of issues and what support could be accessed. In terms of identifying the safeguarding of Adult A, really one of the areas where we felt that as a panel, individuals and professionals need to really develop their practice is around the legal literacy. So understanding and being aware of each other's roles so that, terminology and thresholds and those sort of areas are fully understood by professionals, and that we felt could be done through some joint learning, continuous professional development or case studies.
Heather, for many safeguarding adult reviews, there's often an issue about a lack of information sharing, and appreciate that was a similar kind of case during this review. Could you tell us a little bit more about that and kind of that holistic approach? Because I'm kind of conscious that you know, this straddled both children and adult services.
Yes, definitely. I mean, it links back to the identification of safeguarding, really, and thinking around a little bit wider and taking that whole think family approach to complex families. It's about, you know, making sure that professionals who are dealing with a family don't just take each member in isolation. It's taking every opportunity to identify what their needs are, how complex they were in this situation, and just recognizing those kind of risks that might show themselves, and ask questions. Be really open-minded, curious. Why wasn't this particular lady coming out of a bedroom? Why was she not engaging? Why was she not coming downstairs, leaving the house? And really, you know, that helps you to think a little bit more around you know, what support might be available, what decisions you might need to make, and thinking a little bit outside the box around the type of support that might be able to help a family that's so complex. Um, there are, as I said a little bit earlier, different available avenues of support. We identified that potentially she could have been the victim of cuckooing and exploitation. And there are local arrangements available to refer appropriate cases in. And there is the Community Safety Partnerships Cuckooing Forum for you in Northamptonshire, and all agencies can raise issues to that to be able to you know, put the support in for those people. The other thing that we also identified, that there was a lot of information available about all members of the family, and when adult A and another member of her family made an application to the housing department, there was a huge amount of information that she provided to them, which would have kind of assisted in giving that bigger comprehensive picture of what was happening within the home. So, you know, social workers, social care practitioners can actually request that information from housing authorities, and it does help to build that much bigger picture so you know exactly what you're dealing with.
So were there a number of barriers that prevented professionals identifying issues and accessing support for adult A?
Yeah, so in terms of the barriers to information sharing, really, there was an issue identified around IT, and how different departments couldn't easily access other people's information, which is quite normal. But actually, what needs to happen is that staff, particularly within children's and adult services, do have the knowledge of how to request and access data, and you know, that organisations wouldn't generally have access to each other's information, but it's really important that they know how to make an application to achieve that. Some other barriers were around differences in terminology, thresholds for intervention and support, understanding each other's team's practices, and really, you know, thinking about cross team, cross organisations working, so that people can work together to achieve a solution. Um, One of the other barriers is really about time, and timeliness of assessments was really critical in this particular case. It's relevant across both adults and children's safeguarding. And also, when you're making referrals into other support services, they really should be made without delay. Um, so also, in terms of when individuals do make a referral to another organisation, or within their own, to be fair, in this case, you know, a referral into adult social care from a children's perspective, you know, the working together guidance would say that if you make a referral and you don't actually, or you're not satisfied with what the follow-up is, it should be escalated. So I think it's really important that people do follow up and escalate their concerns when they, you know, are not satisfied with an outcome, or think, actually, no, we shouldn't be closing this case. We should actually be taking it further.
Thanks, Heather. You mentioned earlier about the long history for adult A not engaging with services. Could you tell us a little bit more about what you found as part of this SAR?
Yeah, so in terms of adult A's engagement with services, as you've identified, this was a pattern of behaviour, and there were some specific examples that we found where that she would not engage or would partially engage, and in particular there was there was a history documented with her GP, where at one point the GP surgery wrote to her because she hadn't engaged with them, and there was a situation where her and her daughter actually spoke to the GP and asked to remain within the surgery. But there was a specific example within the July of 2021 where she contacted the surgery, and said this was in relation to some assessment for social care, and the GP asked her to then make a further appointment so that she could have some necessary tests carried out. It was really apparent that it was always difficult for her to make contact with professionals, and particularly around her health, and by actually asking her to make that further contact, it was apparent that she probably wouldn't do that, and it was a missed opportunity. And I think she displayed this several times throughout the review period we looked at, is that, for her to make a contact with a professional just didn't happen an awful lot. And she would also give misinformation and say that she was already engaged with another professional or whatever, almost to show disguised compliance, and to make them really step away from her almost. So it was some behaviour that was ingrained, and it was obvious, to professionals. There was a real feeling from the practitioners that what adult A wanted to do was to keep her family together, and that was particularly a point where it would have been quite a good hook to really talk to her about and be able to gain her trust and her support moving forward. And it may well have been that it would have been better to identify somebody who could advocate for her, or an intermediary in that situation, to just really gain that buy-in from her, to be able to do that. And I think very much so, particularly in terms of people who don't engage with services, is understanding why they don't engage and understanding the root cause, and being able to kind of find something where you've got some common ground. There was some really good practice from a couple of the professionals who really identified that getting a foot over the door and speaking to her in person really worked. If you tried to ring her, text her, then that's easily avoidable. But actually, face-to-face meetings with her were more successful.
In terms of self-neglect, I kind of understand that it can be quite a difficult thing for professionals to identify. What did you find with this case during the course of the review?
Yeah, I think it is a very challenging area for everybody to work in. It's not necessarily that the safeguarding response is the one that should be adopted, but actually it's trying to work with an individual once you identify it. And I think that was a key point within this case, that professionals didn't necessarily identify she was self-neglecting. And she was self-neglecting in terms of her own physical health, but also in terms of her environment, a home environment, to the point of it being cluttered and dirty. There were real concerns around just the environment that she was living in. But actual the professional curiosity didn't go really far enough to really understand what the root cause was, why she was neglecting in the way she was. So it is about asking those questions and sort of getting that soft intelligence together to understand what was happening within the home. And as we said earlier, it's unusual for somebody not to leave the home for a 2-year period, and I think that could have been looked at further. It is very challenging for people, not only in terms of identifying that self neglect, but getting to that root cause and trying to find the support that would help and working with them. I think it's really important for frontline practitioners to be supported by their supervisors and to be able to discuss with them, what they're seeing and what they could possibly do to assist in it. So I think going forward, it's really important that everybody who works within sort of on the front line has that knowledge of what constitutes self-neglect. What is it? How can we respond to it? And what support is available? Self-neglect cases are only reported in very low numbers, but actually there's a significant amount of reviews that we undertake, SARs that we undertake, which really do relate to self-neglect, and it's one of the key areas. And I know you have a self-neglect toolkit, and that's a really useful and self-neglect pathway. That's a really useful framework for practitioners to access, to look at, and to be able to discuss with supervisors and use in these sorts of circumstances.
That's a really valid point, Heather. And yeah, there are a lot of resources there on the NSAB website, but particularly the self-neglect toolkit, I think, is invaluable to our colleagues. In respect of adult A's children that lived in the family home with her, I appreciate that actually they weren't recognised as her carers, particularly as she hadn't left the family home for 2 years. Is there some information you could share with us on that point as well?
Yeah, I think in terms of younger carers, both of her children did identify themselves as her carers, but actually it was only the younger one, who was a teenager, who actually was referred to the Northamptonshire Young Carers for an assessment and some potential support. But what we found was that the quality of information that was passed to them was substandard. And again, going back to the delays, it built a delay into that actual process. Again, a repeat of the failure to engage. The Young Carers Service also found it very difficult to engage with adult A. And sadly, no assessment was really made of the needs of either of her children. So I think there's two things really. One is identifying where people are young carers and making sure that they get that referral and the support. But secondly, also that the right information is passed to that agency so that they understand the complexity of the situation. And in this case, I don't actually think that was the case. And they didn't have all the information that actually could have helped them build, again, a picture of what was happening within that family and being able to provide that support.
Did you identify any good practice through this SAR?
Yeah, I think as I outlined a little bit earlier, one of the really good pieces of practice was in relation to a couple of the practitioners who were really tenacious, and they were really keen to try and build that relationship with adult A and the family, and they really recognised the value of making personal calls and getting a foot in the door, and being able to engage face to face with them. I think there is no substitute for being able to do that and to just find that that common ground where they can try and engage and support and see what's happening within the home. So, you know, they displayed some real good tenacity in being able to do that. And I think sometimes, you know, people's resilience is challenged when you are just not getting that engagement. So you do need to keep going and find a route through it.
Heather, knowing what we know now, what are the missed opportunities, and what do you think colleagues could do differently in the future?
Yeah, so I think throughout there were a number of points where opportunities to identify what was happening to adult A in her situation were missed. There was a referral to the multi-agency safeguarding hub in the January. There were 3 further safeguarding referrals. There were a number of face-to-face contacts which could have resulted in kind of different outcomes. But the focus was very much around the children and grandchild as opposed to what was happening with adult A. And in all of those interactions and those referrals, the information around adult A was there. So it was either missed or the significance of it wasn't actually seen. So those were the missed opportunities. There was a specific missed opportunity from the GP that we outlined a little bit earlier, knowing that she didn't engage well. The GP could have really capitalised on that contact with adult A in July, and she could have made, you know, rather than ask her to make an appointment, you know, that could have been done very differently, and somebody actually allocated to see her at home. So that was a missed opportunity.
So from this review, Heather, what would the kind of 3 key messages be to take away from this SAR?
Yeah, so I think in terms of 3 key things that people can take away is really services generally need to take more of a holistic approach, a think family approach when they're dealing with complex families, to identify all of the needs of each individual member of that family. Being more professionally curious and being able to identify when somebody is self-neglecting, asking the right questions and knowing what to do and where to get support. And then finally, really, in terms of identifying when somebody is not engaging, that lack of engagement, being quite innovative about trying to find solutions to that engagement, talking to supervisors, trying to get to the root cause of why they don't, you know, is it fear? Is it something completely different? Is it embarrassment or whatever it is, trying to get to the root cause and finding those solutions, because that will hopefully reduce the risk to that individual by taking that action.
Yeah, it's really important, isn't it? And again, I think this just highlights the importance of joined up working, you know, sharing the relevant information to support, and particularly in cases of self-neglect where we know people perhaps don't engage as they should do with services that are there to help as well.
Yeah.
Thank you, Heather. Chloe, I think you're going to share some information for us on where to find additional information.
Okay, if you haven't done so already, please visit the Northamptonshire Safeguarding Adults Board website at www.northamptonshiresab.org.uk, where you can read the executive learning briefing for this SAR. We also have a wide range of policies and procedures available, campaign materials and resources, including an easy read guide, bite-sized learning videos and a list of safeguarding contacts. You can contact the Safeguarding Adults Board via email at nsab.ncc@westnorthants.gov.uk. We also have an X account where we share key messages and news and learning opportunities, so please do follow us over there.
Really helpful, Chloe, thank you. Yeah, and I would encourage colleagues to have a look at the website. There's a whole wealth of information there. There's bite-sized learning videos similar to this, but really short, kind of 5 minutes in duration, lots of policies and procedures, and lots of practitioner guides and other relevant information. really, just before we finish, just to make colleagues aware that there are a set of recommendations from the review. These are collated into an action plan, and as part of NSAB, we meet with colleagues to agree the actions to complete those recommendations, and we monitor those really closely through to completion. Just to thank everybody for being part of this session today. Hopefully the colleagues watching this will find the information of help, and you know, it does give a summary of the case, but please help us to raise awareness of the learning, share it in team meetings, training sessions, and help us make positive change to practice. Thank you.